Hey, Dr. Steve, how's your
Hey,
hand from yesterday, man?
uh, huh? What do you mean?
The hand that you whacked the nail into yesterday on live on TV, man.
Oh, that little thing. That's no big deal because once I had that nail in there and I pulled it out, and then I just did my Friday 5 pain busting strategies. My favorite one is the
Hey, Dr. Steve, hi again. Hey, I don't know about you, but I learned a ton this past week. And you know
I
what? And I teach this stuff, and I learned a ton this week. It was
oh,
awesome.
it was really fun. I can't wait to share about our top 5 pain busting strategies. Before we do, our quick disclaimer to remind you that we are not your doctors, and that although we're going to be sharing some wisdom and information about healthcare and well-being and pain, our objective is to educate you, make you more objective and educated consumers, so you can go to your healthcare professionals, go to your healthcare providers, and ask the right questions, and get the very, very best possible care to get the outcomes and results that you're looking for.
I hear you, Steve. And also ask your questions right here on the application below. Comments, questions, we love those. It helps us to answer those questions. And remember, when we answer your questions, it's not just you we're helping, but it's all the other people out there that are too afraid to ask a question. So, and there's a lot of those. So, also like us on Facebook, join us or subscribe to us on YouTube. This helps. So jump right on in there.
All right, well, let's get to it then. We're going to be kind of running through a few ideas with you, reviewing some things that we talked about last week. And Tim, why don't you take it away with the first bit of information for busting pain?
Okay, Steve, I think this is really, I'm glad it's number one because I see knowledge therapy as the number one numero uno most important thing if you want to self-care, minimize your own chronic pain. You've got to know that there is an emotional component to chronic pain, and that's what knowledge therapy is. It's just like self-treatment, self-care treatment of your chronic pain by knowing more about the true essence of pain. And we're doing a lot of teaching on this particular course, and I'm continuously learning a lot more. So I'm continuing on with my own knowledge therapy. I just took a course earlier today. I didn't even tell you this, Dr. Steve, but our numbers, by the way, were way low. There's actually 100 million people that suffer from chronic pain, not 66 million like what we talked about yesterday. And between 2000 and 2010, there was a huge increase in the billions of dollars that were spent on chronic pain, and increases in imaging and X-ray and MRI, and increases in surgeries, and increases in spinal injections and cortisone and all that kind of stuff. And guess what? There was up to 1,000% increase in all that kind of diagnostic and treatment stuff, and the results were poor. No one really got any better. The perceived improvement on the pain scales was flat. All those billions of dollars spent, crazy. So that's why our work today is so important, to get that knowledge therapy out, that there's a mind-body connection. That's what knowledge therapy is.
And Dr. Tim, it really it strikes me how we've become so indoctrinated and so, in essence, hypnotized into following the advice of the of the medical community, of the overall way that things are done. So much so that even in the face of no relief, we'll still keep doing the same things. And as Einstein said, insanity is doing the same thing over and over again and expecting different results. Well, guys, here's a perfect example of that. We're insanely going forward with more drugs, more treatments, more diagnoses, and yet as you very well know, if you're here on the show, you're likely to be somebody who's still suffering. And maybe this is the time to really gain that knowledge and begin to think in an entirely new way. Would you agree with that, Dr. Tim?
I totally agree. So that we did, number one was knowledge therapy. Why don't you lead us in number two?
Well, the second thing that we started talking about that we offered you as an exercise was what we call sentence completion exercises. We wanted to get you in the habit of using a journal, using a writing device to begin to understand what and why you have pain, what the purpose of pain is in your life. And that's something that you could begin to learn just by asking yourself that question. What is the purpose of pain? How am I benefiting from this pain? How does this pain show up as being congruent with my self-image? In other words, if I feel that I deserve pain, then in all likelihood, I'm going to have pain. If I feel that the only way that I'm going to stop working is if something drastic happens, then it's not going to be surprising when something drastic happens. And so we encourage you to write at the top of a piece of paper, the reason I'm in pain is, and then to start writing answers over and over and over again. And this is a very powerful pain busting strategy, because as you start to do this, again, you're gaining a higher level of self-awareness and knowledge, which will translate into lower pain. Now, it's been remarkable to me to see how many people will do that exercise, and just by virtue of doing the exercise will say, you know what, after I wrote about it, the pain diminished, almost as if they sort of told on themselves. And as soon as they told on themselves, it no longer made sense for them to have the same symptoms. It's fascinating. So sentence completion exercises, start journaling, start writing sentence stems, the beginning of the sentence, and then answering those sentence stems again and again in every possible way that you can in regard to your pain. So you start to look at it from every possible angle.
Right. Thank you for that, Dr. Steve. I found, and I think I was mentioning to you before the show, that I see a definite connection between this sentence completion exercise, journaling, when you're actually kind of talking to yourself, like you said, you're telling on yourself a little bit,
right,
getting reduced pain with that. And then that dovetails right into number three, which is develop a relationship with your pain. Now, that might sound, on the face, that might sound silly. Like, why do you want to spend any extra energy on thinking about your pain and dwelling on your pain? And it's true that if we're not talking about dwelling on the pain, we're talking about having a conversation with the pain, getting to know it, and realizing that it doesn't have to have that kind of power. It doesn't have to have power over you. So go ahead, Steve.
We've often abdicated our responsibility for choosing what our level of pain is. And so we just let it happen to us like we're a victim. But when we speak to our subconscious mind, we develop that dialogue, then we can sometimes have a positive influence on how pain is manifested or perceived in our bodies.
Right. And I was fascinated by your exercise that you shared last week about influencing the subconscious. Maybe you could just refresh our memories with that. Remember, like, you had a couple of things like with the pendulum. Remember the pendulum exercise? And you can actually tap into your subconscious. Could you repeat that?
Well, there were a few areas there that we got down to. One of them was the idea of touching the area of pain and inquiring what it has to tell you. That's a very direct process that will often give you surprising results. The other is the idea of the sway test, which is standing up and asking your subconscious mind to give you a yes, which is you swaying forward. And as you find that happening almost automatically, you'll begin to convince yourself that there is communication happening from your body back to your conscious mind. And that really begins to give you that acknowledgement or understanding that there are things you can say to yourself that will be heard and responded to by your unconscious mind, which is responsible for maintaining all of the homeostasis, all of the natural balance within your body, including how you perceive pain. And then we talked about the pendulum, the idea that if you hold a pendulum still over a circle and you say, yes, 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 eventually that pendulum will start to move in a direction that matches essentially the way your body experiences yes, which is for most people a forward and back movement of the pendulum. You're not doing it on purpose. You're not trying to stop it, but all of a sudden that pendulum will just start to move. And then you'll stop it and you'll say, no, no, no. And lo and behold, that pendulum will start going perhaps right and left. And then you start to realize again that these very, very subtle movements of your body, which are producing the movement of the pendulum, are out of your conscious control. They are your subconscious, and they are, to a great extent, that part of you that has an impact on your experience of pain.
Right. And to me, I could be wrong here, but pain resides in the subconscious. So I think the majority of pain resides in the subconscious mind. So if we can converse with our pain, and we can also converse and have an influence on our subconscious, then can't we be, by default, have another mechanism to decrease our own chronic pain? It seems logical to me.
Absolutely. Well, the way I would probably fine tune that definition is to say that the subconscious is where all of the interpretations of pain are taking place. You're not deciding, gee, I think I'll let this thing hurt or not hurt. You may have an override, and we've been teaching you some methods to override that. However, in the moment when something happens and when the pain arises as pain or as whatever it is, that is a subconscious decision. That's not happening at the level of your conscious mind. And so, yes, if you gain greater capacity to control and direct your subconscious mind, you can shift the interpretations that it makes of the experiences that it has.
Shift interpretations. I'm down with that, man. I'm down with that. So that's cool. And I see such a line between, like a direct connection between the sentence completion exercise, and journaling, and then the relationship with your pain, and then the subconscious. And I don't want to skip one because, Steve, you're going to come up and do the morning ritual, but I don't know. I love this, and I didn't even see this line until I started to prepare for today's talk. But I just think it's got a symmetry and a beauty to it. I don't know. It's got a mind of its own. I love it. Steve, you should share number 4 with us now.
Sure. Well, number 4 on our list is that you need a morning ritual. And Dr. Tim and I both shared our morning rituals with you, both of which had certain consistent components, one being hydrate. We want to make sure that you're drinking plenty of water, getting plenty of liquids in you, healthy liquids in you. That doesn't mean soda and sugar and lots of caffeine, although Dr. Tim does like his coffee in the morning, and I'm all for it. But I want you guys to really hydrate yourselves and keep yourselves well hydrated, because that's an important part of your well-being. Another we talked about was meditate. Meditating, the ability to quiet your mind and bring your focused awareness to a particular point. That will allow you not only to relax, but also at the time when you need to experience your pain without aversion, without resistance, the practice of having worked on your mindfulness will have a tremendous impact on how you're able to just quietly, peacefully observe the pain that you have, to embrace the pain. What the Navy SEALs like to say, embrace the suck.
Yeah, I love that.
Such a great concept, because sometimes you've got pain whether you like it or not, but the way you resist it will determine if it's going to continue or not. And remember, what you resist persists. So again, your morning ritual has to include hydration, meditation, movement. We've got to stay in movement. We've got to keep ourselves in movement. And you can combine some of these, right? I go out for a walk with Woody, and I maintain awareness of my environment. I maintain awareness of my breath. I maintain awareness of Woody himself, or the feeling of my feet on the floor. But again, it's this kind of gradual process of gaining a greater degree of presence, something that we definitely don't learn growing up. It's something that's so available to us. And when you start prioritizing presence, being here now, not getting caught in your head, not being resistant to what is, you're going to find that it already begins to cause you to lose layer upon layer of pain. And so a morning ritual is our 4th takeaway, and we want you to really take that one to heart.
Yeah, like pulling the layers of an onion, getting down to the essence of your personality and yourself.
That's right.
That's what it's all about. And sooner or later, if you've got chronic pain, you're going to peel that away, and you're just going to get down to your true being, your true essence of who you're supposed to be and who you want to be.
I love that.
One of the things, and I haven't talked.
Yeah, I love the concept, because when you when you make that your priority, the peeling away layers is your priority. Yes, the pain may come off as one of those layers, but then you're still not done, right? Because it's really about elevating your consciousness, about being more present, about being able to live a full life. And we want you to be able to let go of all your old baggage, not just the pain, not just the anxiety, not just the old, depression, but every layer of anything that's in the way of you living a perfect life. And so the techniques that we're talking about, I think Dr. Tim would agree, are techniques that are designed to do more than get rid of pain, but getting rid of pain is a very powerful and very predictable byproduct of this process.
Yeah, Steve, and I'm reminded of we're going to have to get on this one topic. Maybe we should do it next week, and that's setting an intention for your health.
Yes.
So it's not good enough to say, I want to get out of pain. I'm going to do this, and this, and get out of pain. What's going to help that process is setting an intention for yourself, and then learning. And I know that with your hypnotism, Dr. Steve, you're going to really help with this, is really getting a person to believe in their intention. If they say, you know what, I want to be able to pick up my grandchild, and I haven't been able to do it yet because my back's killing me. But if they don't quite believe that they can get well, they're not going to get well. So I know that with your hypnotism and your skills that you have, I know that you have techniques to help that and burst by that, because I'm convinced that everybody, if they follow the work here, the biopsychosocial method of pain relief, they set an intention and they do the work on their own, that they're going to be able to pick up their grandchild.
And all of that really fits in the of knowledge therapy. The knowledge therapy, completions, developing a relationship with your pain, having a morning ritual. And Dr. Tim, what's number 5 on our list today?
Number 5 is the ice cube exercise. And this was your exercise that was awesome. And I thought this was a connection between the other, several of the other ones too. So we could talk to our pain. We stick our hand in the ice bath. It's going to get really cold and painful. We're going to time the amount of time that takes before we have to pull our hand out.
Right.
And then we're going to do it again. However, we're going to talk to ourselves and we're going to say, boy, this is a rather pleasant situation that I'm in right here. And this is pretty awesome. And I might as well do my meditation while my hand's in this ice bath. And then we're going to time that amount of time, and it's going to be greatly increased. Did I get the gist of it, Steve?
Absolutely, yes. And you see what's happening in the process is that you're making peace with aversion. It's not a comfortable or pleasant sensation, but if you make peace with aversion, you'll find that you're able to lean into discomfort rather than running away from discomfort. It's going to have a very profound effect. So it doesn't take much to fill a bowl of water with some ice cubes and try it out. So try that one. It's a great pain busting strategy.
So what you're saying, Dr. Steve, just to sum up the ice cube exercise, is that we ourselves can influence our pain. Is that what you're telling me?
100%. 100%. And remember the story I told, last week about the folding chairs hitting the floor and having people decide based on a slight suggestion that was actually a relaxing cue rather than a scary cue. We are ready to receive new information, new cues, new interpretations of stimuli. And you don't have to accept the first one. Just because that cold, by default feels unpleasant, doesn't mean that you have to leave it at that. You can create a whole new story around it that empowers you.
Super cool. Can you share a bonus with us? Not just Friday 5, but the Friday 6.
That's right. So today I wanted to bring one more concept to you all that would be a really powerful pain busting strategy. Now, remember, we talked about the morning ritual, and I promised that today I would talk about a ritual that you might do at a different time of day. And so here's a ritual. You could do it in the morning if you'd like. I don't. I prefer to do this a little further into my day. And I'll tell you that this technique that I'm about to share with you will not only help dissipate pain, but it will also dissipate anxiety and depression and low energy. So well worth practicing this. And this is a technique from a body of work that we're going to talk much more about in later shows. This comes from Wim Hof, who some of you might know as they call him the Iceman. We'll have lots to say about him later. But the technique that I'm going to share with you is a breathing technique. And the technique goes like this. You're going to lay down or recline. Don't try to do this standing, sitting up straight, or walking, because it'll knock you right out. But if you're lying down or reclining back, what you want to do is you want to breathe deeply from the belly and all the way up, right? So deep breath, and then passively exhale, and deep breath, and passively exhale. You want to do that 30 times in a row. Now, while you're doing it 30 times in a row, you're going to get dizzy. You're going to feel weird. You're going to almost feel like you want to pass out. Don't worry about it. It's not bad. It's normal. You should expect these kinds of experiences to happen. Maybe a little tingling, maybe a little heat in your face. Whatever sensations you feel are totally okay. But you want to do that 30 inhalations and exhale. Full. And when you get to the 30th exhalation, as you let it out, you want to just stop breathing. Hold your breath on the exhalation. And then just stay like that and set a timer. Now you want to see how long you can go on that exhalation. So you've now exhaled. There's no air in your lungs. The air has been expelled, and you're just laying there looking around. And what's going to happen is that the first few times you try this, you're going to feel this panic, this powerful urge to breathe, because it's a reflex, and it's a reflex you've had all your life. But if you decide that you're going to instead turn your attention away from that reflex and toward what you're seeing around you, just look around the room while you're laying there. Notice what it feels like inside of your body. Just start to become comfortable in your own skin. Try to suppress the urge, or at least comfort the urge to have to breathe for as long as you can. Try to make it at least a minute the first time. Once you reach the end of that minute, or whatever period of time you could successfully hold the exhalation, I want you to then take a nice deep breath in and hold it in. And after about 10 seconds, I want you to bear down so that you feel yourself squeezing the blood all the way up, all the air, all the way up from your belly into your chest and all the way up to your head. And again, you may get dizzy and you may get a little lightheaded, but you're going to squeeze for 5 seconds and then resume breathing normally. Now, here's what's happening. While you're doing that, you are hyperoxygenating your blood and you are blowing off carbon dioxide. The result of changing the balance of those in your body, the balance of oxygen and carbon dioxide, causes you to become more alkaline. Your blood becomes more alkaline versus acidic. When your blood is alkaline, you don't need more oxygen in that moment. You really don't need to breathe probably for a lot longer than you realize. And if you just allow yourself to get comfortable with the experience, which is weird, almost sort of trippy, and just looking around and not getting freaked out by the fact that you have a reflex to want to breathe, what's going to happen is that by following that instruction, the 30 deep breaths, holding the exhalation for as long as you can, then a deep breath, 10 seconds, and then bearing down for 5 seconds, and then resume normal breathing, is that you're going to see a shift, a change. And it very likely, much of your pain will dissipate because you see your nerves are responding to the biochemistry of your blood. And if your blood is more alkaline, that means that the nerves will feel less irritation. You'll feel less pain. You might also notice greater energy and a greater amount of positivity and optimism. So it's a fantastic exercise, and I strongly urge you to do that this week.
I thought you were going to tell me to go jump in an ice cube filled refrigerator.
Yeah, don't tell them that part yet. Yeah, no, we'll certainly get to the cold. But right now, that's your exercise. 30 deep inhalations, exhalation, hold the breath out as long as you can. Set the timer. You try it a couple times in a row. The second cycle, you might go longer than a minute. Give it a shot.
Great. And I think the overarching theme for this whole week is that we have more control than we think over our chronic pain. There's a lot of things we can do. We're not going to play the victim anymore. We're going to take control. We're going to do some things, and we're going to have a positive effect on minimizing our own pain. And I just think that's fascinating. So, Dr. Steve, can you share some things we're going to be doing next week?
Oh, good stuff. Next week, we're going to do some really neat things. We're going to do a little hypnosis. As a matter of fact, if you happen to be interested in being a case study on our show next week, please email us at info at theouchdoctors.com. And if you've got chronic pain and would like me to do a little hypnotic session with you, as long as you're willing to allow us to broadcast part of it, then we might just take you on and give you the opportunity to see what that does. So we'll do a little hypnosis. Tim is going to give you his pain beating smoothie recipe, right?
Yeah, exactly.
We're also going to talk about pain as an emotion. I'm fascinated by that idea, Tim. And some case histories of some of our clients, hear a little bit more about what we've done. We're going to get a little groovy. More on that later, right? And how Tim almost died from back pain. Really, Tim?
It's totally true. It should be like a reality series, but it's true. And I'm going to keep you in suspense till next week.
Awesome. Well, guys, it's been an absolute pleasure being with you here today. Again, if you'd like to talk to us about working with us privately to rid yourself of pain naturally, just drop us a line at info@theouchdoctors.com, and we'll be sure to get right back to you. So, having said all that, we'd like to leave you with this. Train your brain.
Lose your pain.
Take care, guys.